Hi, my name is Kweku. I'm a pharmacist. In this video, I want to break down some of the key things that you need to know about the medication Eliquis, or Apixaban, as we call it by its generic name. We'll cover how it works, what it is used for, proper dosing, potential side effects to watch out for, important safety precautions, and how it may interact with other medications. So let's start with the basics. What exactly is Eliquis? Well, Eliquis belongs to a group of medications called anticoagulants. We often simplify it and refer to all of them as blood thinners, even though for Eliquis, it doesn't actually thin your blood per se. What Eliquis really does is make it harder for your blood to clot. Now, clotting is definitely a good thing because it stops bleeding when we get a cut. But sometimes blood clots can form inside our blood vessels when they shouldn't. Such unwanted blood clots can be really dangerous as they can block blood flow and lead to serious conditions like stroke if it happens in the brain, deep vein thrombosis or DVT, usually in the legs, and pulmonary embolism or PE if the clot travels to the lungs. So anticoagulants like Eliquis are crucial because they help prevent these harmful clots from forming in the first place, reducing the risk of these serious health problems that I just mentioned. Now let's take a look at how Eliquis works. A critical part of the clotting process is something called factor Xa. Now, factor Xa is an enzyme or a type of protein that helps seal the wound and stop the bleeding. Without it, it will be very, very hard, or it will be much harder for our bodies to heal from injuries. Eliquis works by inhibiting factor Xa, effectively reducing its ability to contribute to the clotting process. So by blocking this factor, Eliquis slows down the blood clotting pathway. Now, it's worth mentioning that Eliquis does not entirely stop blood clotting. Instead, it reduces the likelihood of undesirable clots forming, particularly in conditions such as atrial fibrillation or after surgical procedures, which brings me to our next section, the uses of Eliquis. Eliquis is approved by the FDA for several important uses. One of the most common is to reduce the risk of stroke and blood clots in people who have a condition called atrial fibrillation or AFib. Now, this is a type of irregular heartbeat that can increase the chance of clots forming in the heart, which can then travel to the brain and cause a stroke. Another key use of Eliquis is after certain surgeries, especially hip or knee replacement surgery. Now, these surgeries can temporarily increase the risk of blood clots forming in the legs, which is called deep vein thrombosis or DVT. These DVTs can sometimes travel to the lungs and cause pulmonary embolism or PE, which I mentioned earlier. Now, Eliquis is often given after these surgeries to prevent DVT and PE from occurring. Eliquis is also used to treat DVT and PE when they do occur. If someone has developed a DVT or PE, Eliquis can help prevent the clot from getting bigger and can help your body break down the existing clot. Also, for people who have had a DVT or PE in the past, Eliquis can be used to reduce the risk of these clots coming back again in the future. So it's not just preventing clots initially, but also for long-term prevention in certain cases. Now let's talk about dosage and how to take Eliquis correctly. Eliquis is usually taken twice a day. Now, there are a couple of common strength or dosages of Eliquis. You might be prescribed 2.5 milligrams or 5 milligrams, and sometimes other doses as well. However, the exact dosage that is right for you would always be determined by your doctor. They will consider things like the condition being treated, your kidney function, your age, and other medications that you might be taking. So needless to say, never adjust the dose by yourself. Always consult with your doctor. As for how to take Eliquis, it's pretty straightforward. You can take Eliquis with or without food. It doesn't matter if you're just eating or if you're taking it on an empty stomach. What is important is to try and take it around the same time each day. What this would do is that it would help to keep a steady amount of the medication in your system, which is what you want for it to work effectively. Now, onto some potential side effects. Now, because Eliquis works by slowing down blood clotting, the most common side effect is an increased risk of bleeding. This might show up in a few different ways. For example, you might notice that you bruise more easily than usual. You could also experience nosebleeds or bleeding gums when you brush your teeth. And you might find that cuts take a little longer to stop bleeding. These types of minor bleeding are fairly common and usually are manageable. Now, while severe bleeding is less common, it definitely can happen and it requires immediate medical attention. Some signs of serious bleeding to watch out for include unusual bleeding or bruising that you cannot explain, urine that is pink or brown, or stools that are red, black, or tarry. You should also be concerned if you cough up blood, obviously, or blood clots, or if you vomit blood or vomit that looks like coffee grounds. Other serious signs include a severe headache or feeling very dizzy or weak. Now, if you experience any of these more serious bleeding symptoms, it's crucial to seek help immediately. Like I always say, it's better to err on the side of caution when it comes to potential bleeding, especially if you're taking a medication like Eliquis. Now, it's important for me to mention that not everyone who takes Eliquis will experience any or all of these side effects, and many people take it without any significant problems. But obviously, being informed and knowing what to watch out for is always the best approach. Now, let's talk about some precautions and some best practices. First, it's really important to discuss your full medical history with your doctor before you start taking Eliquis. There are certain conditions that can increase your risk of bleeding or affect how Eliquis works in your body. For example, make sure your doctor knows if you have any kidney problems or liver problems, as these can affect how your body processes the medication. Also, be sure to tell your doctor if you have any bleeding disorders or a history of stomach ulcers or bleeding. These conditions obviously can make you more susceptible to bleeding while on Eliquis. If you've recently had surgery or if you have any planned surgeries coming up, even if they are dental procedures, it's crucial to inform your doctor that you're taking Eliquis. In some cases, you might need to temporarily discontinue the Eliquis before the surgical procedure to minimize the bleeding risks. Another pro tip is never stop taking Eliquis suddenly without talking to your doctor. This is extremely important. Eliquis is prescribed to protect you from blood clots, and if you suddenly stop taking it, your risk of forming a dangerous blood clot can actually increase. Also, if you're pregnant, breastfeeding, or planning to become pregnant, it's essential to discuss this with your doctor. Eliquis might not be suitable during pregnancy or breastfeeding, and your doctor can help you, obviously, to weigh the risk and benefits and decide on the safest course of action for you and importantly, your baby as well. Now let's look at some potential drug interactions. Well, it's impossible to list every single medication that could interact with Eliquis, but there are some common types of medications that you should be particularly aware of. For example, pain relievers, we call them NSAIDs, that you can buy over the counter. These include things like aspirin, ibuprofen, sold under the brand names Advil or Motrin, or naproxen, sold under the brand name Aleve. All these can increase your risk of bleeding when taken with Eliquis. So you should generally avoid taking these types of pain relievers regularly while you're on Eliquis, unless your doctor specifically tells you that it's okay to do so. Similarly, caution should be exercised with other blood thinners like warfarin or Helprin. In most instances, they should be avoided in combination with Eliquis, as this can significantly raise your bleeding risk. Now, certain types of antidepressants, specifically the SSRIs and the SNRIs, can also increase your bleeding risk when you take them with Eliquis. So typical examples will include the sertralins of this world, the duloxetines of this world, venlafaxine, Paxil. Those classes of antidepressants, you should be careful. They increase your bleeding risk when combined with Eliquis. Not saying you can never take them together. The risk just goes high. So it's good for you to know and discuss with a doctor to make sure that it's okay for you. Also, some herbal supplements like St. John's wort can interact with Eliquis. I guess the key takeaway here is that always make sure your doctor or your pharmacist has a complete up-to-date list of all your medications that you're taking, including prescriptions, over-the-counter, vitamins, and supplements. This way, they can check for potential drug interactions and make sure that your Eliquis is safe for you and it is working as effectively as it should be. I sincerely hope you found some value in this video. If you did, please give us a thumbs up, and as always, stay blessed and catch you on the next video.